happening tonight in Vancouver.
I think it's a risky election. Number one, Justin Trudeau has been Prime Minister, and that's a disadvantage.
Plan to go to the polls with Justin Trudeau reportedly aiming for a September 20th election.
Today, we need to take an additional step to reduce transmission.
Another family's not going to have to go through what my family's currently going through.
If you want to walk through the doors and work at a long-term care home, you will need to be fully vaccinated. Those working in the industry share their thoughts on the latest public health order in BC, plus the other places and venues Dr. Henry believes you shouldn't expect to be let in if you're not fully vaccinated.
So when I hear that not enough is being done, that hits me in the heart, right? And it not only hits me, it hits every firefighter out on the ground.
Amid accusations, crews say they're doing everything possible to fight the White Rock Lake wildfire near Vernon, which has burned thousands of hectares of land. We get a bird's eye view of BC's wildfire battle.
This is City News Everywhere.
I think it's a risky election. Number one, Justin Trudeau has been Prime Minister, and that's a disadvantage because people might get tired of him. Number two, he's been Prime Minister and decisions have been made that people aren't happy about.
It's been this summer's worst-kept secret. Canada is preparing to go back to the polls. The Prime Minister is reportedly expected to go to the Governor-General this Sunday and ask her to dissolve Parliament and call for fresh elections. New polling suggests the Trudeau Liberals are in the lead, but one analyst says the Prime Minister's position could be open to attack.
So that families right across the country have access to affordable, high-quality childcare.
The campaigning seems to have already started, with Trudeau and ministers crisscrossing the country, handing out promises of money for projects and putting together the beginnings of a national child care plan. The pandemic and economic recovery from it are largely seen as the main election points parties will be campaigning on, and the federal Liberals will be judged at the polls on how they handled COVID-19. The Prime Minister has been criticized by both the NDP and Conservatives for calling an election as the Delta variant drives a fourth wave, but Abacus polling data shows most Canadians aren't terribly concerned.
About 1 out of 5, 20% say they would be upset with the Prime Minister for having called this election when that risk of a fourth wave was pretty clear. But for the most people, they actually say it's not going to really have that big of impact. And I think we have to keep in mind that, you know, of those eligible to vote, probably 80% plus will have had both doses of a vaccine.
The outcome of this coming election, assuming we have one, is not easily predictable.
Conrad Wynne has run polling operations around the world and says while O'Toole lags in the polls, a strong campaign could give him a chance to take the momentum.
I think O'Toole has two advantages. One is he's unknown, and the other is that Justin Trudeau has been Prime Minister for quite a while. And, you know, he could take advantage of that. I think any incumbent government right now is vulnerable.
Meanwhile, the NDP continue to pin their hopes on Jagmeet Singh and will be looking for a different outcome after disappointing results in 2019.
He's the most popular leader in the country right now. Not a lot of people have a negative view of him, but he needs to take that goodwill and convince more people that electing more New Democrat MPs, giving him a bigger say, maybe, you know, he's going to make a claim that he wants to be Prime Minister. He's got the foundation to do it, but you still need to convince a lot of Liberal voters that voting NDP is ultimately the better choice than the incumbent Liberal Party right now.
Now, Trudeau is expected to announce the shortest possible election period, just 36 days, meaning Election Day would fall on September 20th. In Ottawa, Xiaoli Li, City News.
We are announcing mandatory vaccination as a condition of employment for all workers in long-term care and seniors assisted living.
Hopefully, another family's not going to have to go through what my family's currently going through.
Every employee who walks into this care home will have to be vaccinated against COVID-19. The announcement being made Thursday by Provincial Health Officer Dr. Bonnie Henry. She says long-term care and assisted living workers across the province will be mandated to get immunized by October 12th if they want to keep their jobs.
And we've seen spread both to residents and staff, causing illness, but also disruption in the life people in long-term care.
Ahead of the October 12th date, Dr. Henry says unvaccinated workers will have to follow safety protocols that include wearing masks and gloves. Volunteers at those facilities are also required to be vaccinated.
We were informed that my dad had tested positive. He is double vaccinated, but he has severe Alzheimer's.
Kirsten Langen says her dad is one of 2 residents in his long-term care home in Tsawwassen who now has COVID-19. She says he got it after an unvaccinated worker tested positive earlier this month.
He still may not make it. The best case scenario is he's isolated for 14 days. Worst case scenario, they said we're allowed to visit if he's on his deathbed, but we have to be fully garbed, like mask, gown, gloves, the whole gamut. I wish they had been mandated sooner, but I am truly grateful that they are now mandated.
The province currently has 8 outbreaks in long-term care brought in by unvaccinated people. Mike Old is with the Hospital Employees Union, which represents more than 50,000 healthcare workers in BC. He says there will be members who are not happy with the requirement.
Vaccine policy is going to be controversial, and we are hearing from members who are in favor of the policy and who do not like the policy. We think education and access to the vaccine is the key to improving vaccine uptake and is the preferable way to do this as opposed to a mandatory vaccine policy.
But BC Care Providers Association CEO and former BC Liberal Health Minister Terry Lake says the mandate is the right move.
Outbreaks increasing in long-term care because of the Delta variant. So vaccination, we know, is the key to protecting those very vulnerable British Columbians. So we're very pleased with today's announcement.
BC's top doctor also says other places like crowded concerts or sporting events have the ability to refuse people entry if they are not vaccinated.
If you choose not to be immunized, then you don't necessarily have the right to go into a higher risk environment with a bunch of people who have been immunized and are protected.
Meanwhile, Langen says anyone who can get the vaccine should.
It's to protect people like my dad, who has 10 grandchildren and a wife and 4 kids who love him dearly. And we can't see him because he has COVID.
In New Westminster, Ashley Burr, City News.
COVID-19 continues to tighten its grip on BC. Over the past day, we've recorded 513 new cases. There is 1 new death, and it's in the Interior Health region, which is dealing with a devastating outbreak. What is concerning is we're seeing a rise in hospitalizations. Compared to yesterday, there are 9 more people in the hospital for a total of 81. Meantime, just over 73% of eligible British Columbians have both shots. As the Delta variant has infection rates surging across the country, Canada's Chief Public Health Officer out with a declaration at today's update.
The latest national surveillance data indicate that a 4th wave is underway in Canada, and that cases are plotting along a strong resurgence trajectory.
There are more than 13,000 active cases of the virus across Canada. That's more than double the number from 2 weeks ago. Over 1,500 new cases are being reported each day, with the majority being among the 20 to 39-year-olds. Dr. Tam says we're also seeing early signs of increased severity, including rising hospital admissions.
We believe sooner or later you will need a booster.
U.S. regulators are reportedly set to authorize booster shots, but not for everyone. Which Americans could be rolling up their sleeves a 3rd time? And what does Canada's top doctor have to say about giving out additional doses?
Breaking news tonight, the entire community of Logan Lake is being evacuated because of a wildfire. About 2,000 people live in the area. There is no accommodation available in nearby Ashcroft or Merritt, so evacuees are being told to go to Chilliwack, which is about a 2.5-hour drive. The fire is 36,000 hectares in size.
Dead trees, lots of stuff laying on the ground.
To say that more resources would be denied, as an incident commander, I will take as many resources as I can get. However, with the situation that's present in the province, the resource shortage that's out there nationwide and in North America, let alone around the world, is, we all know and understand what's out there.
Crews are still working to get the White Rock Lake fire burning near Vernon under control. It was first spotted in mid-July and is one of 30 fires of note in BC. It's been heavy work for the team of nearly 200 living in tents not far from the fire, and they could be here until the first snowfall. Despite everything, they've been accused by some members of the public of not doing enough.
When I hear that not enough is being done, that hits me in the heart. Right? And it not only hits me, it hits every firefighter out on the ground. That's the hardest thing to hear.
Healy says much of the crew is made up of young people.
They're young millennials who live on social media, and they are not taking this well, the message that gets out there, and I worry about them.
Healy has close to 30 years of experience fighting fires, and he calls this one's behavior beyond extreme. They still expect the fire to grow. It's already burned 56,000 hectares.
We have crews who are working as hard as they can to do the best work that they can, and the constantly changing weather and fuel types that are out there.
Cian Carroll helps feed and take care of the crews.
You see a very exhausted person. You see a person covered from head to toe in ash. You know that they've been working. If they're covered in it, they've been breathing that in for the day.
As for reprieve, it appears there is very little ahead.
Number one, the heat. So temperatures are already on the rise in the southern interior. We'll be up into the mid-30s, dry conditions. Not a lot of humidity for that part of the province too, so that doesn't bode well. And the second part of the equation, and probably the more concerning or significant piece, is the winds.
At what point do we start to see potentially some really good rainfall for the province?
Yeah, real relief, it may not come until October. We could see in September, a blast of wet weather that lasts for a week. It's not out of the question. It does happen around here. But over the last dozen years or more, Septembers have been incredibly dry.
Mother Nature is a fickle, and she keeps throwing things at us that keep it challenging. And we do what we can with the skills that we have.
Ria Renouf, City News.
The bad air is back. An air quality advisory is now up for all of Metro Vancouver and the Fraser Valley, partially because of the wildfire smoke drifting in from the interior and Washington state. Hot, sunny conditions are also leading to high concentrations of ground level ozone. The regional district says the smoke is currently impacting the central and eastern Fraser Valley, and other areas could see it too as the wind, temperature, and wildfire conditions change in the days ahead. People with underlying medical conditions are being told to hold off on outdoor physical activity until the advisory is lifted.
Wasn't sure if I would be able to make it back.
From BC to Japan, Paralympic athletes are preparing to take off to Tokyo. How they're getting their bodies and minds ready for a place on the podium. Heading for a ferry terminal this weekend? Be prepared. BC Ferries says the mid-August weekend is usually one of the busiest of the year. It's because families are either heading home from their summer vacations or they're heading out to squeeze in another trip away from home. The corporation suggests the best way to make your travel plans more enjoyable is to book in advance or be prepared for sailing waits.
This is a multi-billion-dollar industry, most of that going to organized crime and another large percentage going offshore into the gray market.
Ottawa hoping a new law on single-game sports betting will undercut the illegal market.
FDA is working with Pfizer and Moderna to allow boosters for these vulnerable people.
American regulators are reportedly set to authorize an additional shot of the 2-dose COVID-19 vaccines for those who are immunocompromised and face greater risk from the virus,
which is especially important as the Delta variant spreads. Following FDA's decision, CDC will hold a meeting of its advisory committee on immunization practices tomorrow to discuss this issue and offer their expert insights and recommendations.
It's estimated approximately 2.7% of U.S. adults are living with compromised immune systems, such as people who have had organ transplants and some cancer patients. Emerging data suggests they may need extra protection against the coronavirus.
They often didn't generate enough antibodies even in the first place, so they didn't get the full protection.
protection.
America's top infectious disease expert does not believe the elderly or others urgently need a third shot. Still, he says the government is evaluating a booster strategy for all vaccinated Americans on a day-by-day basis.
It's a true statement that we believe sooner or later you will need a booster for durability of protection.
Canada's top doctor says discussions are ongoing on the potential need or benefits of boosters in certain populations, including the immunocompromised.
For now, our top priority remains ensuring as many people in Canada who are eligible are vaccinated.
The World Health Organization has called for a moratorium on booster shots until the end of September to allow at least 10% of the population in every country to be vaccinated. So far, more than 4 billion doses have been administered globally, but our World in Data says only 1.2% of people in low-income countries have received at least one dose.
Canadian doses that are identified as surplus will be donated to international partners on an ongoing basis.
Canada will donate all 10 million doses of the single-shot Johnson & Johnson vaccine to poor nations. The J&J vaccine was authorized in March, but never used in this country. Karen Ciolin, City News.
Wasn't sure if I would be able to make it back.
BC's Paralympic athletes are getting ready to fly to Tokyo, eager to get back to competing after all the uncertainty. We caught up with a couple of athletes who told us about the challenges of getting their bodies and minds ready after the pandemic halted all competitions.
Congrats on making the team, Dion. We're so proud of you.
Victoria's Dion Green played for Team Canada in wheelchair basketball in Rio in 2016. But back on home court a year later, he dislocated his left shoulder at practice and needed surgery.
I was out for about a year rehabbing it. I spent 6 weeks in a sling and really just had to focus on building the muscle back up. And then sort of felt like I was starting from the beginning. I went back to practice and I felt like the rookie again. I was like, oh, I got to do this all over again.
After some doubts and a lot of rehab, Green has been watching the Olympics in Tokyo in anticipation of his turn on the court.
Yeah, that's definitely helped my competitive spirit get fired up. I'm so excited to get there and to get on court and just to show everyone all the hard work we put in.
Burnaby's Felicia Voss-Shafiq works as a software engineer and is a sitting volleyball athlete. She says along with getting in physical shape, the team has been working with a mental performance coach.
I mean, I personally went through a roller coaster of emotions with work being as busy as it was and the uncertainty of the Paralympics. I wasn't sure if I could perform physically or mentally.
Voss-Shafiq found out after a volleyball tournament in 2011 she contracted pneumonia that resulted in blood poisoning. She underwent surgery to amputate her legs below the knees and was hesitant at first to try sitting volleyball, but friends and family pushed her into the sport. She says her support system has only grown larger.
But my teammates know exactly what I've gone through. When they give me advice about things to try and things to do when I'm going through different challenges, I get it. They get it.
The team didn't qualify for the Paralympics until one of the last tournaments in 2020. Since then, their minds have been set on Tokyo.
We had to win gold to qualify for the Paralympics. So we just had to stick to that mentality that the Paralympics were going to happen. We had to do everything that we could to be prepared.
The Paralympic Games kick off August 25th. In Vancouver, Crystal Adaris, City News. Vancouver's news is always available on the radio with News 1130 or online anytime at citynews1130.com. Your next edition of City News is tonight at 11 o'clock. Thanks for watching and have a great night.